Good evening and welcome to the 15th episode of Leadership Conversations in the Development Sector. The social impact sector is full of passionate leaders with innovative outlooks on the world's greatest problems. Our leadership conversations focus on the unique insights offered by these leaders as they share their experiences and move the development sector forward. Our host, GoBarefoot, is an interactive web portal dedicated to the social sector. It brings together individuals, NGOs, NPOs, and the CSR arms of organizations with the mandate of creating a one stop information website for both networking and knowledge sharing. We're supported by Catalyst, an NGO which has been preparing young women for leadership roles to create equality in opportunities and bridge the gender gap. Also, we are supported by third sector partners, India's only executive search firm exclusively for the development sector. Our guest today is one of the leading lights in the development sector. I would like to extend a warm welcome to Rumana Hamied, Managing Trustee, Cipla Foundation. Rumana has had a long and diverse history of engagement with social causes. In her professional capacity as a film producer, Rumana mainstreamed issues of gaps in access and affordability in healthcare through her internationally acclaimed documentary film, Fire in the Blood. Alongside, Rumana has been closely involved with the Hamied Family Foundation, playing a pivotal role in mapping the family's philanthropic commitment. She's on the board of the Cipla Palliative Care and Training Center, Pune, India. Since 2014, she has been spearheading Cipla's corporate social responsibility strategy, leading Cipla Foundation through initiatives in health, skilling, education, and disaster response. In conversation with Ms. Hamied is Kakkar Mehra, leadership expert and executive presence coach for CEOs. Shital has trained over 75,000 professionals across Asia and has personally coached over 1,000 CXOs in the past 2 decades. She has conducted workshops for diverse organizations across Asia and has been invited as a speaker by leading B schools and professionals associations. She's a best-selling author, and her latest best-selling book, Executive Presence, The Poise Formula for Leadership, is India's first research-based formula on this leadership skill. Shital is an active philanthropist and social entrepreneur. Thank you, Rumana and Shital, for joining us here today. Over to you, Shital.
Thank you, Sakshi, and welcome, Rumana. We are excited to hear your views.
Thank you for having me. I'm really, honored and excited to talk to you and to your viewers. So,
thank you. So, I'm going to start with the first question. The development sector is constantly evolving, changing. It's a very dynamic environment. As Cipla Foundation, what has been the trajectory of growth and how has it contributed to the learnings of the corporate sector?
That's a very good question, actually. As sectors, we coexist and we're an extension of our mothership, right? So for those who may know Cipla and the quest for accessible medication is always at the forefront, right? We try to escape the tyranny of numbers and keep our patient front and center with everything we do. And so its foundation actually struggles to keep up with the corporate. It's actually a lot of learnings in ethical business, keeping people at the core of what you do, and at the same time applying a very democratic lens. Those are the three, biggest learnings that we get from our corporate. And, our global CEO, who sits on our CSR committee, always guides us with that firmly in mind. And so I always say I'm very, very lucky to be a corporate foundation that's, harnessed to a corporate that, fundamentally believes that CSR should be in every process and not just a process in itself. But since we started 7 years ago and we catalyzed the philanthropy that Cipla was doing into strategic, giving and CSR. And along the way, I think it's become a symbiotic relationship, where the corporate, also learns from us that, the ecosystem needs collaborative working. It needs us to address real issues and not just tick a box in legal and compliance. And for that, we get a lot of support as well, because that's a big, for NGOs to navigate legal and compliance. It's great to take the corporate along with us and apply the corporate learnings that we have to the space, which is demanding that kind of compliance. But equally, we find that with Cipla for Change and 26,000 of us coming together, we've been able to create a sense of ownership for folks in Cipla, to their proximate communities around our factories, all India, for example. And I'm really pleased and proud to say that Cipla for Change pivoted very quickly. So by June 2020, we went online. And for the last 2 years, we've been able to give people an opportunity to remain connected. Because while we were all very productive, it was the connectivity that started dropping. So if people could come in and create audiobooks or mentor or do craft, we suddenly found that there was, an excitement in this engagement. And I think that's what the foundation can offer the Cipla family. And now that luckily that we're back offline, we see that having kept in touch over these past couple of years has given us really involved and invigorated people who are, asking, what do I do? What can I do? I'm in Sikkim, and these are the local issues, and I'm local to Sikkim. So come on, let's work together, right? And so that's exactly what we hope for every day.
Superb. Yes, technology has proven to be a game changer and connected and brought people together. And yes, I agree with you. It's great to be back offline. But yes, those 2 years have definitely added to the connectivity. So I'm going to shift gears a little bit and talk about collaboration. So how does the Cipla Foundation work with different stakeholders and bring together the corporates, NGOs, and the government to work together? And how do you think this is important? As we have seen even during the pandemic, that the governments had done policy making, the corporates had to come up with the medicines and the masks, but it was the NGOs that really impacted at the grassroots level. So how does Cipla Foundation work with different stakeholders and bring them together?
Yeah, so that's good. That gets me to articulate what we do a little bit, which is the first and the most fundamental thing is let's avoid replication, right? We're a really new foundation and there's lots to learn from other people, and also to understand the government system and how it's working, especially because India is so variable and we are in every state. But actually, if you take beyond factories, you take depots and distribution, then Cipla truly is in every pin code of this country. So one is that we have to, frame what we do, and we go out there and find NGOs and there's some great and very dynamic ones that not only are working very closely with the government to enhance their own schemes or be the catalyst, right? So the schemes exist, and maybe their children are out of school and you need that NGO to be the catalyst, but at all times not building a parallel system. And I think that's always been our goal, is that they're incredible people doing really great work. What can we do to strengthen their hand? How can the grant be structured so that we are not just a funder, but a partner? And so then things like capacity building, even in legal and compliance, in HR, which come more easily and more naturally to us, is something that we look forward to being able to help the NGO navigate. Rules change every day, form after form arrives. And we really hope that our partner NGOs feel like they can call us at any time and for anything, And we have had to be extremely flexible with each other, right? Because realities were changing every week, and money had to be diverted from education to health, and like you say, into food. And so actually, what do? We don't really do anything. It's all these amazing people that said, okay, you know what, I'm not doing child protection right now. I need to feed the community that I serve, and can you help me do that? And those were the conversations that have come from years of collaboration, right? Where we trust each other that, the funding's there, we are not going anywhere. And what it is actually, whatever you need, where are your strengths? Play to your strengths. We'll build the bottom of the pyramid for you, which is your capacity. And so it's been really heartening to have met so many people, and also to see the journey that they have with the government, right? So then we can triage, we can say, especially in health, right? Because in health, it is something that you want to be a part of the institution rather than back off and build something parallelly. And you may have to in certain things, but as far as possible, that's also been very satisfying. And I'll just give you a really small example that we work very much and very deeply in palliative care. And palliative care, very simply, is that extra layer of support that a person with a serious illness will need at any point, especially at diagnosis, right? So the diagnosis of a serious illness is a tsunami, and you need the support right away. And we come in to different medical institutions and provide that support. A lot of it is HR and training. So for me, our biggest accomplishment was Nair Hospital, because it's a corporation hospital, and the head of the pediatric department at that time, Dr. Shishma Malik, said, just stay with me. I will make a pediatric palliative OPD a reality. It took over 2.5 years, honestly, because it is a maze, and we did have to, rely on her to navigate the BMC. But in the end, look what we have. We have a wonderful OPD where children beyond cancer, right? So palliative care is beyond cancer. And so we're seeing kids with a lot of neurological disorders, and we feel so proud that Nair has given space, right? Space is like platinum, I think, in a corporation hospital. And that not only have they given space, they've allowed us to train nurses in pain scales, and at every step of the way, Dr. Malik has become my hero, because it's the public health professionals, 35 years in the system, are your guide, and there's no one else who can, safely take your vision forward than a public health professional.
Very true. Thank you for such an elaborate answer. And yes, it's changed the way, we look at palliative care, as well as the wonderful work done by the foundation. I'm going to just move to another very important thing which happened in the CSR world in India, which is a law which came into effect in 2014 and has proven definitely to be a game changer, because it made philanthropy compulsory for corporations. So what are your views on how it was implemented and how it has changed the world of philanthropy in India?
So that's a tricky question, right? So for me personally, I'll say, for Cipla personally, because philanthropy was always important but diffused, it forced us to give ourselves direction, work with purpose, and give with intent, right? So I joined Cipla in 2014 in the foundation, just as the structure was being built. We had the foundation as a vehicle, for the giving. Now it became a real foundation. And Anurag Mishra, who now runs the foundation, and on whose shoulders we stand, came in because of this law, right? And because we were forced to wake up and say, look, philanthropy is not going to work for a corporation. It might work for an individual because there is money going to come off the P&L of Cipla. It's a responsibility to every shareholder to give back this kind of detailing that the law is asking us for. Not that it's without a flaw, and it's not that it sometimes doesn't get very onerous, but actually I rather think of it as an incentive rather than a tax, and in this way we get to involve ourselves, safely take 2%, right? 2% of Cipla and its subsidiaries, create impact. Now, I don't think that we would have been as evolved if these 7 years hadn't, given us also the framework, right? Because it's quite definite, the CSR framework, to do what we do today. So not that I wouldn't change a few things, but on the whole, I think that anything that helps you move forward and anything that pushes you to do more in a more strategic way is good. And so for that, and now, for example, we are writing our social capital section. And because we have these structures that we can report back so easily, on what we do, and there's comfort at every level that what is being done has been signed off.
Wonderful. I agree with you. It's given structure to philanthropy, at least a basic, skeleton. And yes, it may require some fine tuning or some course correction over the years, which I think will automatically happen. But yes, it was a good initiative and has been implemented very well by your foundation as well. So moving on, the Cipla Foundation, how does it, take the Cipla legacy forward?
So, yeah, that's a good one. So Cipla's legacy, is summed up in one line, which is caring for life. And for 85 years, there's been a sort of single-minded endeavor, to care for life, to put it into action every single day. And so for us, adopting a health vertical came very naturally, because that's, the company's been involved in medicines and healthcare for so long that we have large relationships, but we wanted to take that legacy the last mile, right? So ultimately we are a pharma company, but the foundation doesn't have those constraints and can work much, much deeper. Like Cipla had one palliative care center that they set up in Pune in 1993, totally visionary, because by 97, when it started, working, no one even knew what palliative care was. It's still a bit unknown, and we are trying. But today, thanks to Dr. Prakash Fernandez, we have partnerships from Silchar to Srinagar to Trivandrum, and I think that's where you say that your founders gave you palliative care as a principle they wanted you to really live, and then you're lucky enough to find people like Anurag and Prakash who actually live the legacy, right? Because they are the future. They live this future every day, and actually that's the impact that the foundation has been able to give the legacy, which is to give it wings and to take it in to communities.
Super, very nicely put. Thank you. You've explained it so well. I'm just going to stick to the foundation. One more question, that the foundation has worked extensively through initiatives in healthcare, in skilling, in education, environmental sustainability, and disaster management. In fact, disaster management was was the very active unit during the pandemic, and continues to be so. So please share some leadership lessons that you learned in this whole initiative of disaster management during the pandemic.
What didn't I learn, actually? That's the thing, that I see leadership in action every single day, both at Cipla and in the foundation. And because, we work so closely with each other in the community, that what I saw, and this is across, right? Cipla never closed, of course. Pharmacies, the pharmacy has to remain stocked. Hospitals need life-saving drugs. So Cipla never closed, but even the depots never closed, right? But then the foundation realized that truckers suddenly don't have food on their long journeys from picking up medication and to dropping it to the depot. And out of the blue, Anurag called and said, now that's where our focus is going to be. We have to feed every single trucker along the route, right? So flexibility and thinking about somebody else, down to that degree is where I see his leadership in action. Because what is leadership? It's empathy. And it's about saying that, okay, somebody's making the drugs, someone's consuming the drugs, but the one person in the middle is getting left out. So for me, it was, and that this was April 2020, right? So for me, it was these, acts, and these are the moments, I think, where leaders stand up and make, moments matter. And also across Cipla and the foundation, people were worried about their own health, about their own families, and yet people got into the company bus or they went out into the community and they played their role. And I think that everyone's hand went up to be counted. And for that, we're immensely grateful, because people were very worried. People had a lot of loss in their own families. And so the disaster came home to each one of us, right? Usually you have a cyclone, hurricane, some other part. It's not in every single person's home in some way or the other. And then to say, I'm still there, I'm still standing, and the foundation can count on me, is extraordinary. And, here I just want to call out the Cipla Palliative Care and Training Center in Pune, because so then, as you know, COVID started raging quite soon in Pune, and we work with highly immunocompromised people, and the center didn't close. And they literally closed for a few days to restructure, put in isolation wards, and that was it. And what was even more significant is that Dr. Priya said, I'm not stopping home care. I mean, I know hospitals that have still not restarted their home care. And here was a team that said, unless it's in a red zone, we will be there. And if it's a red zone, we will get so close that we will get the relative and drop the medicine. So,
wow, what commitment to the cause.
Yeah.
How do you motivate a team that is so motivated?
Well, they motivate me. It's just the other way around, It's when Dr. Priya has a young son herself, and yet she's out there taking care of, extremely ill people in a raging epidemic, right? So in the epidemic, everything got forgotten but COVID, but cancers still goes on. Dr. Vivek still has to treat, patients. And it was finding that space within COVID for other ailments and keeping our eyes on them. Because for COVID, there was not much that the foundation can do other than maybe, but food and relief support. But what our work had to continue. So
True.
that when COVID receded, we were not going to have a bigger mess on our hands. And that's, what every single person did at the foundation.
That's so amazing. You use the word empathy, because development sector, social impact sector has always spoken about empathy. But today corporations also are talking about leaders with empathy. And yes, it's interesting that leadership has also evolved, changed in both development and in the corporate sector. I know it's very difficult to predict, but according to you, Rumana, how will leadership change in the post-COVID era?
I think you got it right. It's empathy today, because everyone has been hit by COVID. There is a lot more empathy. Just saying that we're all one. We all went through this, and so I don't think leadership will be the same again, because we now have a common bond. Not to say that some of us were not in a cruise liner and other people, as that analogy goes, were drowning, but yet leaders put themselves out there, and a lot of us leaders got together as well to say collaboratively, if we give, let's say, to a dasra, then it goes further, and it can be done at a level that we are not equipped to do. And I think it's understanding your shortcomings is what every leader is now looking at, is saying, what I can't do, can you do for me, or can you do with me? And I think that that's the way we'll change, right? Each other. And
so true. Yeah. For the first time, we heard collaborative philanthropy. For the first time, we heard respect for the environment and sustainability in the corporate world. For the first time, we also heard the fact that, leaders can get together and so much can be done. And so, yes, I think, that's very interesting. Now, the sector, of course, has significantly changed and evolved in the last 3 decades. So how has leadership, according to you, change, evolved to rise up to this challenge, and how has tech, of course, has augmented it? So what is your view on that?
So I think tech has brought us closer in ways that we could not have imagined when you and I started our careers, right? So tech has revolutionized the way we collect data, we deploy data, we treat people, right? Today we are treating, through a teleconsult. And that's something COVID forced us to do. But when we couldn't reach someone, we were forced to learn how to give palliative care online. But we could, because most people have a smartphone, right? It would not have been possible without telecommunications of that level. So then you can think further, right? You can think that, okay, I'm going to have a course on rheumatoid arthritis, and we had pediatricians coming in from Tehran and Dhaka. So in a way, tech has shrunk the space and allowed easy access of knowledge. Leaders also have come in from the corporate space, right? So that today we have more leaders who I left the space and then came back. So I think that kind of leadership didn't happen earlier, right? That people were not able to come here. It wasn't as well organized or well paid, and that's changed. So it's attracting very dynamic corporate leaders who today are saying, you know what, I'm crossing over, right? So I think that between tech and people choosing it as a career rather than a default or as a volunteer has been for me the biggest difference in the last at least the last 2 decades.
Agree with you 100% that talent has of all kinds is today available, and also the young the millennials are very motivated to be a part of a sector like this, so the profile has also changed. And yes, tech also has changed. Now yours, of course, is a foundation, but tech has also changed the donor profile. So people sitting in any part of the world, even if it was $100 contribution, they were vehicles that with a click of a button they could make that contribution. So yes, it has enabled, increased the funds, philanthropy. So yes, many multiple changes. Now my final question to you is that we have a lot of young listeners in the room. We have people from NGOs, NPOs, social impact sector, and a lot of young professionals who are looking for your advice on leaders of tomorrow in the sector. So your 2 or 3 tips that you would like to give them as leaders of tomorrow.
Sure, I'm sure they have a lot more to give me, but my only thing would be is you don't have to wait till tomorrow. You are a leader here and now, and take the initiative. Really think out of the box. Look for opportunity, right? So look in your home, your hometown maybe. What are the opportunities for change? Involve yourself. think about it. Because unless you are part of the solution, people will make solutions around you for you and your community that you're not going to perhaps agree with. And if it is you want to play a part, then you have to give, of your time. Right now, I would say just learn and see what interests you. It could be, the welfare of stray dogs. It could be climate change, girls' education. Don't limit yourself. Understand what it is that people are offering you in terms of knowledge, and then just go out there and commit. Whether and it's not always your money that you have to commit. You can commit your skills. We have CAs coming in or accountants who are happy, to brush up systems for an NGO. Just, you can commit your time as a volunteer. Reading to someone is not going to take that much time. But believe me, the time I've spent with the visually challenged at the Victoria Memorial School has changed my understanding on what a disability is and what it can mean. And I think that if we take ourselves out of our, ivory towers and decide that, look, I could be 23 or 25, but I want to understand what's happening. I'm going to learn about it. And then I'm going to go out there and see, because tech, right? You own tech. In ways that, and you can use tech in ways that I can't even dream of. And so you're already there. All you have to do is, just find the commitment. And I think that if you do find it now, then you will change the course of what's going to happen in your lifetime. And just go out there, but go out there with the mission to serve and, to understand that everyone at the core is the same. And all we want, is roti kapra makan, and there's no difference. And once we have that, and we, truly have that, just go out there and own the space and, make us all redundant.
Super, wonderfully articulated. And yes, thank you, Rumana. We have run out of time, but we have not run out of questions. And really, really appreciate you taking the time out to interact with the young listeners in the room. And thank you once again. And goodbye.
Thank you.
Thank you. Thank you. Bye.